A breast augmentation is a procedure to enhance the size of your breast and improve the shape of your breast. And there's basically two different ways of doing it. You can use a breast implant, which is one of the more common ways, or one of the newer ways that we do breast augmentation now is to use your own fat and to enhance your breast size and shape with liposuction and fat that's grafted from another part of your body. A breast augmentation, or a boob job that some people call, is to restore the shape of your breast, enhance the volume of your breast. In some patients, that's done when you've lost volume, either after weight loss or pregnancy. In other patients, it's because they were never satisfied with the size of their breast to begin with, and those are the patients that are really good candidates for breast augmentation. So there are different kinds of breast implants that we can use. There's saline breast implants, which are filled with saline or water. And then there's silicone breast implants, which are filled with a silicone gel. You can also choose not to have a breast implant at all and to use your body's own natural fat. The differences between saline and silicone are going to be in the way they feel and the way they look. And some patients are really good candidates for either. And some patients would be better off if we used one or the other. And we go through all of those choices when you come in for a consultation to figure out what is really the approach that we should use for you. When you're choosing a breast augmentation surgeon, it's really important that you find someone that has a common vision in terms of the aesthetic that you're looking for. There's a lot of different approaches to doing breast augmentation. Specifically, we use a more natural approach, a more natural aesthetic, and it's very important that your goals and the surgeon's goals are in line with each other. A typical breast augmentation takes about 2 hours, 2.5 hours. Basically, it's about a half a day of your time. You go home the same day. You're feeling fine the very next day. You'll have some soreness in your chest. Most people can go back to work after a few days or a week, and we require that you avoid any strenuous physical activity or exercise for a couple of weeks, but you'll be feeling fine after a few days. In our practice, we like to use 3D virtual imaging and virtual surgical software to give you a virtual 3D preoperative assessment of what you're going to look like after the breast augmentation surgery. That's one of the most advanced tools that we can use to really figure out what you like and get your vision in line with our vision so that we know what your expectations are and how to achieve the best result.